organization. So it's a quite high degree, very high degree of organization in Norway. And that may be the most important figure, around 3% unemployment. The latest figure in April was 3.6% unemployment. I believe this is the lowest unemployment rate in Europe. So the main problem in Norway is the lack of workforce. And this is also since the, or I would say it in this way, the last 30 years, half of the workforce are women. So the women entering the labor market in Norway is the most important difference between 30 years ago and now. So there are some challenges. Some sectors, as cleaning, restaurants, are characterized by a large number of questionable enterprises and social dumping. And also, those people in these branches have quite low education. Parts of the working life are characterized by high levels of long-term sickness absence and social exclusion. Health and care services and transport sector are among them sectors where there are highest sickness absence. People in Norway, when they have 1 day sick or 1 year sickness, they get full paid. So it's around 7% of the workforce are not at the workplace. They are paid by the Norwegian welfare system. Social dumping, large differences in salaries and working conditions among countries is a major challenge. So, according to this white paper, strengthening cooperation and social partnership is an important step to reduce the effects of sicknesses. And it's targeting efforts at different sectors. It's a working life agreement. It's a framework agreement between the social partners, between the government, employer and employee organizations, on how to follow up people who has a sick leave. It's a special measures in order to follow up each individual who are away from work. Reinforcing public supervisory agencies, among them Labor Inspectorate. More knowledge about working life issues in order to find out why people are away from work. Continuing to direct close attention to social dumping. And also mentioned in the white paper is working on specific health, safety, environment challenges as night work and chemicals. So chemicals is mentioned as one important OSH problem. Social dumping, a key issue. It's a key instrument. The key instrument is to make tariff agreement a requisite and obligatory for specific sectors. Inspectorate should have a supervisory authority pursuant to the regulation, salary, and working conditions in public sector contracts. That is proposed as an important measure in keeping acceptable standards. All in all, in these points, it's that the governmental agencies should have a stronger role for the authorities when it's settling acceptable standards. It's a key social dumping issue. And also the prosecution authorities will be brought in to ensure that the regulations are followed up. So it's especially mentioned the Norwegian National Authority for Investigation and Prosecution of Economic and Environmental Crime. They will play a key role in upholding the system. Better knowledge and documentation. This is important to make priorities. What are the main problems? What are the effects of activities carried out, and so on? Improved national statistics on occupational injuries and diseases. And in order to get this better statistics, is a need for cooperation between the Statistics Norway, Norwegian Welfare and Labour Administration, Labour Inspectorate, National Surveillance System for Work, Environment and Occupational Health. This describes the complexity of having better statistics. The Inspectorate will establish a new register for occupational accidents involving serious personal injury. We already have a good statistics when it comes to fatal accidents. It's around 40 to 50 fatal accidents every year in Norway. We have also a register for sicknesses, but this has to be improved. The medical doctors need to report to this register, and they have to be motivated to report to this sickness register. So it's some specific challenges which I will mention. Better understanding where the greater risks are in order to develop and improve the risk-based inspections. Chemical exposure is still a major problem. I can mention that it is anticipated and calculated according to epidemiological data that people dying from chronic obstructive pulmonary diseases are about 200 persons a year. And when you compare it with fatal accidents every year, it's around 40 to 50, then you see a real challenge. And noise is still a problem. Around 70,000 employees claim to be affected by hearing loss due to work exposures. And better company knowledge when it comes to risk factors of night work and how the work situation can be best facilitated to avoid these factors. Thank you for your attention.